Hello, my name is Callista Kaplan, and I am a student at Indian River State College. In this presentation, I'm going to be discussing issues with prevention and treatment regarding internet addiction in adolescence. I graduated with my associate's degree on the psychology track in December 2021. I am currently finishing my bachelor's in human services. I am a registered behavior technician, and I work primarily with children on the autism spectrum. I chose to cover this topic of issues related to prevention and treatment of internet addiction in adolescents because I spend a majority of my time with adolescents who have access to technology, including the internet. I work in homes with children, and I have seen multiple cases of internet addiction, especially in children with autism spectrum disorder. Seeing firsthand the impact that internet addiction makes on children has made me want to research causes and preventions for the sake of the children's futures. Here is an agenda of the topics that I will be covering. The most common types of internet addiction in children are social networking and video gaming. A 2007 study found that 23% of children and teens reported feeling addicted to video games. Gaming addiction is defined as excessive and compulsive use of video games that interferes with daily life, responsibilities, and relationships. Internet browsing addiction refers to a compulsive pattern of web use. This usually includes spending hours browsing websites, social media, or other content. Streaming addiction is also a compulsive pattern, but refers to consuming content from streaming devices such as TV shows, movies, or live broadcasts such as other people playing video games and streaming for others to watch. Physical symptoms of internet addiction in children can include eye problems such as dry eyes or blurred vision, poor posture, weight changes, and neglect of personal hygiene. Social symptoms can include isolation, such as withdrawal from family and friends, conflict with family and friends, increased aggression or irritability, neglect of responsibilities, and loss of interest in previously enjoyed activities. Cognitive symptoms include difficulty concentrating, obsessive thoughts, memory problems, decreased academic performance, and impaired decision making. Recognizing these symptoms is essential for addressing potential internet addiction in children. Internet addiction is most commonly associated with escapism. Escapism is the tendency to seek distraction and relief from unpleasant realities. The internet offers an escape from stresses of real life. This could be the case with a neglectful or abusive home life, social anxiety, or trauma. Emotional factors such as low self-esteem, depression, and anxiety can drive children to seek comfort through online interactions. Lack of supervision in the child's home due to carelessness can also lead to addictive patterns of internet usage in children. Similar to other types of addiction, prevention is almost always possible. To keep children safe from becoming addicted to the internet, parents can take several measures. Setting boundaries and establishing rules can help prevent children from becoming addicted. Encouraging alternate hobbies, such as sports or crafting, can also be useful. Monitoring online activity of children is also a helpful prevention strategy. If necessary, professional help is always an option as well. Issues with prevention can include resistance, peer influence, access to technology, and limited resources. Many families lack access to resources that can help them prevent their child from becoming addicted to the internet. Mental health professionals who specialize in addiction or behavioral issues can provide a safe and professional space for treatment of internet addiction in children. Family therapy can be helpful when dealing with internet addiction because families can come together in a controlled setting to improve communication and foster a supportive environment. Cognitive behavioral therapy, or CBT, is a time-limited psychotherapy that identifies and changes negative thought patterns and behaviors. Through CBT, children can learn to engage in activities outside of screen time, set goals, and develop coping strategies. There are several issues regarding treatment of internet addiction in children. Children are likely to be resistant to participate in treatment due to discomfort. There is also said to be a shortage of trained professionals who specialize in internet addiction, creating another barrier in treatment. Underlying mental health issues, such as anxiety and depression, can complicate treatment further, as these issues require different approaches. Internet addiction, prevention and treatment, and the issues revolving it relate to substance abuse and human services in many ways. Internet addiction, similar to substance abuse, involves a compulsive engagement despite negative consequences. Internet addiction also involves withdrawal symptoms, escalation, and social isolation. Both internet addiction and substance abuse can carry stigma, which can further discourage children from seeking help. Internet addiction and its surrounding issues can also relate to the field of human services for many reasons. For example, human services can combine mental health, social services, and other resources to help in the treatment of internet addiction. Programs can help to raise awareness, educate people, and help to support children and their families. Professional treatment such as counseling and cognitive behavioral therapy is also an aspect of human services. Recognizing and understanding the links between internet addiction and human services shows the importance of a comprehensive approach to help support children who face these issues. I have provided credible resources for support of those who suffer from internet and technology addiction. Internet and Technology Addicts Anonymous is a site that offers free help and support to those suffering from internet addiction. RestartLife.com is an organization that specializes in various types of internet addiction. The Substance Abuse and Mental Health Services Administration is a 24/7, 365 days a year service that is free and completely confidential. In conclusion, treating internet addiction in children requires a well-rounded approach that combines prevention and treatment. Despite challenges such as resistance to change, stigma, and lack of resources, open communication and family support can help those suffering. Working together to support children can help them to build healthier habits with technology and the internet.